Hello and welcome to this session of the medical debate where we will be talking about the history of medicine. So what exactly is the study of medicine? The study of medicine answers two main questions. How does the body function normally? And how do we maintain this functioning? First of all, we're going to talk about ancient Chinese medicine. So qi, you may have heard this before, but qi is the life force. It governs everything. It cannot be harnessed. It cannot be controlled. Cannot be related to it can be related to a version of the soul. This is what the ancient Chinese believed in terms of medicine, and acupuncture was said to be the most advanced therapy at the time. And you can just tell how advanced acupuncture is because we still use it to this day. So, that was a really advanced therapy that was considered at the time. The next main stop in the tour we're taking through the history of medicine was the Ayurveda, or the Gupta dynasty of India. So there was something called the Charaka Samhita. It covered the etiology and symptomatology. It talked about those, which is a very basic overview of the two things, because at that point we didn't know a huge amount about medicine. And they said that 5 karmas make up life. This was quite similar to the humoral theory that we're going to look at later. And the 8 major topics covered in this text were pediatrics, elderly diseases, mental illnesses, organ diseases, surgery, poisons, aphrodisiacs, and treating a patient was called Ayurveda. At this point, all medicine was based on Aristotelian physics and maths, and it was a lot less advanced than we have now. These were the 4 Empedocles humors. So Empedocles humors is actually the fluids that make up your body. And actually, we still use the word humors if you consider B lymphocytes and the immune system. So humoral immunity is concerned with B lymphocytes producing an immune response. So the 4 Empedocles humors were yellow bile, which represented fire, black bile, which represented earth, phlegm, which represented water, and blood, which represented air. Hippocrates was another science, and what does this name make you think of? He was another scientist who contributed to the history of medicine. What does his name make you think of? You can pause the video, but I think at the moment it's pretty clear. It's the Hippocratic Oath. And he was a huge medical pioneer. He released medicine from religious objections and based it purely in science. He established it as a huge science based on fact and observation rather than sort of religious understanding. He invented the endoscope. He invented beneficence and non-maleficence, 2 of the 4 key pillars of medical ethics. Apparently, he was a bit arrogant, but he also wrote Hippocratic Corpus, which were notes written by him about medicine. He said that the environment and diet that people were in influenced medicine, and it was not upon the will of the gods to maintain your health, or when someone was ill, that was not the will of the gods. And this was a huge, huge, huge overturn in the religious dominance of medicine rather than the science. And after this, it became more of a scientific field. So we're going to talk about another scientist, Galen, who actually played a huge part. Galen actually healed gladiators in Rome. He made observations whilst being physician, the doctor for Marcus Aurelius, one of the emperors. He cured gladiators and observed the body in that way because he was not allowed to dissect humans just for scientific purposes. This was illegal at the time. So he used to cure them after the battle, and he observed their bodies in that way. He used to use animals as well, but then there were problems that this led to. And one of the most obvious is that animals and humans do not have the same physiologies. And he demonstrated the larynx and that lungs fill with air through these 2 methods by dissecting animals as well as gladiators which were hurt and trying to fix them. And he actually went on to invent cataract surgery, which is useful for the eyes. AlRazi was another scientist, but he was famous for being anti-Galen. He believed that Galen was wrong. So he made a text called The Virtuous Life. He also made a text called Al-Nabawi. He was a really clever person, and he was a very studious person. And he made the text called Al-Nabawi for medicinal procedures pointed out in the Quran. He also made a text called Shukuk ala Anis Nusor, I know I'm pronouncing these incorrectly, I really apologize for this, or Doubt About Galen. So he directly created a book contradicting Galen. And he was very popular at the time. And so his text became very popular as well, because it was contradicting one of the biggest scientists, especially medicinal scientists of all time. He used both Greco-Roman and Indian texts to make his point against Galen's theories. So just think about the genius that these sort of scientists had, because Galen was able to create observations from animals and gladiators, as well as AlRazi being able to create observations from religious texts as well as other ideas, especially from historical texts like Indian texts and Greco-Roman texts. And I believe this leads into scholasticism, which is where you build upon older theories and older ideas and older books to create new theories. And so it's a really transformative history that medicine has. And now you can see that modern medicine is often called a miracle. And you can see why, because it's been evolving so quickly but so thoroughly at the same time. Ibn Sina, he actually wrote the Canon of Medicine. It was a text of all combined texts and then rebuttals and comments of all. So he used to, he actually collated the different texts and came up with theories of his own for each idea. I advise you to pause this video right now and go through the different people we've talked about and think about, you know, how this has affected modern medicine's development. Although you'll probably not be tested about the history of medicine, it's very important to know some history, especially when you go into the world of medicine. It's very fascinating to see how things have evolved over time. Ibn Sina, he was a Persian polymath, I believe, and that made him, he was also a very intelligent and he interpreted lots of old texts, as it says here, which was a classic example of scholasticism. Thank you very much for listening to this talk about the history of medicine. If you wish to contact us, please look at our Instagram, where we post posts about our latest live events, as well as other news from the medical debate. And if you wish to get involved in our Zoom live events from 4 p.m. to 5 p.m. every Saturday, please email us at themedicaldebate@gmail.com and we will send you a link. Thank you very much for attending this session, and we will see you next time.